In light of some of the really interesting and somewhat extreme decisions that are being made in terms of public health policy right now in this country, I thought it might be good to take a moment and talk about how you as an individual can make good, smart decisions regarding your own health or your own family's health. And rather than commenting on public health policy, I thought it would make more sense to use topics that I'm more of an expert on so that I can give some examples of how you can make decisions, medical decisions, in settings of uncertainty or complexity or concern. So anytime you are recommended either a treatment, which could be surgical or medical, such as medication, or you've been recommended some additional diagnostic testing that seems to have some risk to it, here's a framework that you can consider when it comes to making smart decisions for yourself. Things that'll help to keep you on the right path so that you're making decisions that are thoughtful and appropriate and that are risk concerned, but you're not overwhelmed by risk as well. For the sake of this video, I will be talking about rheumatoid arthritis and how I try to think through and converse with my patients when it comes to making risk and benefit decisions. So first and foremost, you want to consider the treatment that's being recommended to you. You want to think about what are the potential benefits and what are the potential risks. So in a condition like rheumatoid arthritis, we know that there is this progressive worsening over time that can happen, and that the treatment algorithm that we utilize, which involves utilizing immunosuppressant medication, the goal is to really put the condition into a low disease or completely remission status, all right? So that instead of having a progressive condition, you now have a totally flat condition. And so that your overall pain and function can get back to a close to normal status. So a very high potential benefit, and that's why we're considering these sorts of treatments as your regimen. You then need to balance that by thinking about what are the potential risks. And you want to think about what are common risks that can occur, what are more severe risks. And when it comes to severe risks, how often do those occur? Are they frequent? Are they uncommon? And are they things that are manageable as well? From that, you then want to consider how do you monitor and prevent those kind of risks. That's very key. When it comes to your medical treatment, your physician and you should have an understanding about how do you make sure you're staying out of trouble as well. If you have that concept where now you understand what are the potential benefits and why you're doing something, what are the potential risks and how do you monitor those risks, that gives you a good framework of understanding why a treatment has been recommended to you and how you can stay safe when you're being treated. So in the case of moderate to severe rheumatoid arthritis, the potential benefits are such that you can prevent progression, put the disease into remission or low disease status, and thus some of the potential risks are worth the benefit because you can so well control the condition. And here are the things that you need to do to help monitor them along with your physician. The next thing is you want to think about what are the risks if you do not pursue treatment. So in the case of moderate to severe rheumatoid arthritis, the risks of not pursuing treatment are progressive damage, and that can happen even within the first 3 months of disease activity. So high risk of progression. But then you also want to ask, well, let's say you have mild disease activity, right? So mild disease meaning that you don't have significant inflammation on labs, on exam, or on imaging. So the risks of progression in that case, if you do not pursue treatment, are a much lower chance of damage and progression over the next 1 year. If that's the case, you then also want to ask, how do you monitor if you're not pursuing treatment? Meaning, how do you make sure you are not starting to develop a condition that goes from being very mild to now moderate, where now the risk level has now increased as well. So understanding what are the risks of not pursuing treatment can give you a sense of clarity about when it might be okay or lower risk to not pursue treatment. Let's say you have a very mild disease versus where if that risk may be higher, and how you can monitor to make sure you're not developing any of those problems, or to monitor to make sure you're not going from a very mild condition to now one that is moderately higher risk, where you can now develop a lot more problems long term. And then the next step is, if you're considering alternative treatments, think about what are the potential benefits of those alternative treatments and what are the risks of those alternative treatments as well. So for example, let's say you have a patient who has rheumatoid arthritis and they do not want to pursue chronic disease modifying treatment. They prefer to pursue, let's say, lifestyle changes such as over-the-counter supplements, exercise, nutrition, and anti-inflammatory nutrition process. Okay, think about what are the potential benefits of that. By that, I mean, what does the literature, the medical data, the medical literature show about pursuing that kind of treatment approach? So what does it say if you have mild disease activity in terms of pursuing that kind of approach? And what does it say if you have more significant disease activity? And if the evidence for when you have more significant disease activity is that the outcomes are not great, then you need to keep that in mind, that the potential benefits could be different if you have mild disease versus more significant disease. Then the next step, of course, is what are the risks if you pursue an alternative treatment, meaning what are the risks associated with that as well? Some alternative treatments that are not typical medical treatments that we would pursue for rheumatoid arthritis are ones that may have other potential risks that you may not be aware of. So for example, let's say you're pursuing an alternative treatment with certain high doses of certain supplements. Okay, well, just be aware of what some of those risks are before you jump into that as well. And then the last point, which I think you have to really, really emphasize, is that you want to work with experts. The reality is that we now live in a world where our access to information and opinions is so high that the risk of just getting an opinion from a non-expert source when it comes to your own health is that you may not be getting a very thoughtful or reasoned approach. You may be getting an opinion that is just shooting from the hip. The problem with that is, if this is your first go round with a problem and you're pursuing an opinion from someone who has a low level of literacy on that topic, they're not going to have the same perspective or the same sense of what is going to be right or wrong or best in your case, as opposed to an expert opinion where someone has seen a wide range of things, from good outcomes to disastrous outcomes to mild disease to severe disease and everything in between, who knows what the risks are, who's seen what the risks are, who's seen what the benefit is, who has a really thoughtful and deep opinion. And the other thing to consider is second opinions when it comes to your medical care are not a bad thing. It may actually be the right thing for you. It can be helpful for a couple of reasons. Number one, physicians do sometimes give different opinions. The other point of that is sometimes it's helpful that even if physicians have a similar opinion, sometimes it's good to hear that second opinion if it backs up what your first opinion was also. Then the last part of second opinions is that there's nothing wrong with seeking a second opinion that fits what your perspective and philosophy is when it comes to your own care. The only thing is that you still need to search and find what is the objective evidence, meaning that someone else's opinion might suit what you philosophically believe, but if that doesn't match what the actual evidence and medical literature shows, be careful, because you may still lead yourself the wrong way. Always pursue opinions that are expert, reasoned, and are searching for the truth. I think if you take that approach, you can keep yourself out of trouble. You can make decisions in more complex medical environments to keep yourself safe and to keep your family safe as well.